with pioneering publications in the area of stem cell biology. The company's primary focus is to discover and develop a cure for human disease with state-of-the-art, unique stem cell-based therapies and products. Under Dr. Srivastava's creative leadership, a group of esteemed scientists and clinicians are developing stem cell therapies for various types of autoimmune diseases and blood disorders. He has extensive research experience in the field of stem cells, which is documented by several publications in revered scientific journals. Dr. Anand will share his insightful knowledge on the role of stem cell in COVID-19, and which really seems so interesting topic for us all in this post-pandemic period. So let's just welcome Dr. Anand Srivastava from California, USA. So there you go, sir.
Okay, thank you very much for unmuting me, and I'm really thankful to you and Professor Tolokovich, Dr. Prashant, and all the members who was working for conference. This is wonderful to be here with you guys. And this time in California, it is 9:30 p.m. at night. And this is, I think, 11:30 a.m. morning at your place. So can you hear me clearly?
Yes, sir.
Can you hear me clearly?
Yes, sir.
My voice is going. Can you hear me? Okay, good. So, thank you for inviting me also for this conference. And I'm the chairman and co-founder of Global Institute of Stem Cell Therapy and Research, that is California-based medicine. We have our centers around the world, and I started the field of this modern stem cell science working at University of California, San Diego Medical School, and UCLA, that is University of California, Los Angeles, and several places. So important is, let me introduce a little bit about our these are the institutes where I work basically. So important is, I'm going to talk about the COVID-19 and how this entire came. So you know, the COVID is very devastating, and it started in late 19. And so when COVID came, nobody was knowing exactly how they are going to really work on this and how they are going to manage it. And there was no medicine available in late 19 and early 20s, that is January, February, March of 2020. And you know, till now, I think more than 5 million people died around the world. In US alone, more than 700 people died in US because of this COVID-19. So when this COVID-19 started, and as you know that I'm working on stem cell science last 20 years, and I started this modern field of stem cell science here at USA. And there was no vaccine, people were dying, and then I thought what to do, and is it possible to really manage the COVID-19 using stem cells? Nobody was knowing, in fact. So I immediately started thinking how to really do it. And I was working on several lung-related diseases. And it is very important for medical students who are there and listening to me, how to really design something very new when you do not have any kind of treatment available. Once you have a medicine, yes, you can apply for some known or unknown disease. But if you do not have any medicine and some unknown disease is coming, how do we manage it? So there we have to keep our brain open. That is most important. And think how you can face or manage the challenge which is coming in front of you, and what are the available means. Using those means, you may try to manage this problem. So, as I told, I was working on stem cell science. So I thought, is it possible really to manage COVID-19 using stem cells? And I knew that several lung-related can be by stem cells. And we have treated several patients related to lung diseases like COPD or interstitial lung disease and all these things. And those are a kind of an inflammatory disease. So, and I was using, and I'm using basically the specific kind of stem cells to manage those kind of disease called mesenchymal stem cells. And these are the adult stem cells. So these stem cells has very specific character, and it works at 3 steps. First, these are the adult stem cells. It is present your circulatory system, your bone marrow, and cord blood, umbilical cord, and also you may get this particular stem cell from the fat cells. So you can take out the belly fat and you can extract this stem cell. So why this particular stem cells? This particular stem cells has very peculiar character. First, you don't need to worry about matching this stem cell. If you're going to transplant or infuse this stem cell from one person to another person, you really don't need to worry about matching the cells. So it is very much immune competent, means it does not have problem of the rejection by the immune system of the host. So that is the most important character of this. And second, once it is infused, it has ability to balance the imbalance of the immune system. So if there is an imbalance going on inside the body with the immune system, it can go and manage those imbalance of the immune system. So that is the best character of this cell. Then I thought, okay, why not? Because there is nothing available, there is no vaccine, no medicine, people are dying. I'm talking 2020, early 2020, means 2020, February or March. Then I thought, why not to write to US FDA and get the special permission to treat the patient using this stem cell. So I wrote immediately to US FDA that this is the stem cell, which has 3 very important characters. First, it is immune competent, so you don't need to match. Second, once it goes in the body, it down-regulates all the inflammatory genes action and also blocks the inflammatory cytokines. So if you know, in the COVID-19, the biggest problem is the storm. Means once the COVID-19 virus goes inside your body, it binds to the lung alveolar cell, and that is a particular lung alveolar cell, that is type 1 alveolar cell. And then that binds, and after binding it goes inside and create very strong cytokine storm because of the inflammatory reaction, and all the damage starts coming in the lung, and the lung is filled with the water and edema of the lung, and that's what the suffering of the patient and hampering the oxygen loading and all these things, and patient goes under the hypoxic condition and has the problem of the COVID-19 related symptoms. And if it is not treated, 5 million people died already. So immune balance block the cytokine storm created by COVID-19, and also start secreting a specific cytokines to enhance the regeneration of the lung. So this is three particular character of this particular stem cell, which I'm using, and I propose to US FDA. So once I write this protocol and ask the person of US FDA in 2020, use this and manage the code. And I thank people to US FDA that they gave me the permission immediately within 2 weeks. And this was the wonderful thing. Then I think among first institution who got the US FDA approval to use this particular stem cell to treat the COVID-19 patient. And that particular time, there was no vaccine, nothing was available. And we saved several patients using this. So the point first we have to understand, this slide is showing, which I have in front of you right now, that ACE2 receptor is the most important thing for the COVID-19, to attack the COVID-19 virus in the lung. And mesenchymal stem cell really helps in COVID-19 by suppressing the pneumonia and cytokine storm. So important is how this mesenchymal stem cell works. So we transplanted the intravenous mesenchymal stem cell, which is simple. A person is suppose suffering with the lung disease or COVID-19 infection, so lung is compromised. What we do, we take the specific stem cell, that is the mesenchymal stem cell, and we infuse that stem cell in the bloodstream of the patient, and that it goes in the circulation. And because lung is infected, so it is very much targeted for the lung. It goes in the lung and starts suppressing the cytokine storm created by COVID-19 and block the overreaction and start the repair of the lung. So that is the most important point, because the COVID-19 is attacking and the virus is going inside the lung, damaging the lung tissues. So how to really manage this? If you can block the side effect of the virus, and the most important side effect of the virus is the COVID-19 triggered pneumonia. If you can block that COVID-19 created or triggered pneumonia and enhance the repair of the alveoli in the lung, then even the virus is there, it is really not going to do any problem, because virus will just do its own cycle and finally it goes up. So if you basically using this stem cell, you are confining the virus. You are putting a barrier around the virus. Okay, virus is inside, but it is not doing anything. It is helpless because there is no cytokine storm, there is no pneumonia, there is no problem in the lung alveolar damage or anything like that, and virus will go out. So let's see what happens, in fact, in the case of virus. Here you can see the mechanism. This is the mesenchymal stem cell, okay? And when it goes, it manages all this cytokine proliferation, all these things, TNF alpha, which is the most important gene which really triggers the inflammatory reaction. It blocks by this mesenchymal stem cell. So all these bad cytokines get blocked by mesenchymal stem cell and good trigger. So like see when we injected the mesenchymal stem cell, it creates the downregulated C-reactive protein that was decreased. And over activated cytokines, these cells, CR3, ACT, T cells, and all, those all are disappeared. It gone. It finished, basically, because it was neutralized by the stem cells. So there is no effect of this bad cytokine. on the lung or on the body of infected patient. So we saw that after 2 to 4 days of the transplantation of this stem cell, all the symptoms disappeared in the patient. And the oxygen saturation rose up to 95% after the infusion, even in the severe patient. And I'm going to share a wonderful story of a patient. You will be surprised to see that. And there is no point it means distance post. So you all these things. And there is no secondary infections and something like that. So these are the some data actually, which is when it was injected and what were the different fever and all this shortness of breath and cough and all these things. So important is everything improved after the infusion of the mesenchymal stem cell. So important is this slide. If you see the patient has COVID-19 infection, you can see the lung, and here cell was transplanted. Okay, and you see how strongly it is infected. Almost 70% of the lung is infected. And after 1 week, if you see, this lung started getting cleared because of the mesenchymal stem cell infusion, and patient got rescued. So there are a few publications came out, and so that's the beauty of the mesenchymal stem cell. So what happened in summary, excessive inflammation in and around the lung is the primary cause of pneumonia and death of the COVID-19. Evidence exists indicating that stem cells have anti-inflammatory effect, which makes the treatment effective in combating COVID-19 pneumonia. And what happened is patient in 6 to 7 recovered just in 2 days, and they were discharged. So this is wonderful actually, and there is no side effect at all. These are the other data related to the patient, how the severe and critical patient behaves after the COVID-19 infection, and using of the mesenchymal stem cells in the COVID-19 patient. These are the few companies who also received this FDA approval after COVID-19 treatment. So important is, so I told about the COVID-19 with the mesenchymal stem cell. But I just want to tell that how this vaccine, which is made by Pfizer or Moderna or different companies like mRNA vaccine or DNA vaccine works, that is also very important to understand, and particularly for the medical students who are listening. So, what are the main difference between mRNA vaccine, which is made by Pfizer and Moderna, and for AstraZeneca? So here I am telling you this mRNA, which is Pfizer. It is just tripeptide molecule, and then it is injected. So it does not go inside the nucleus. This mRNA goes and translates S protein of the virus, and that express at the surface of the cell. And this goes and secretes IL-2, IL-4, IL-5 cytokines and B cell and plasma cells, and these plasma cells makes the antibodies. And these antibodies, if virus comes, suppose somebody gets the virus, so this antibody is for the S protein only. So if virus is going inside the body, these antibodies are there and they go and catch this S protein of the virus. and the bloodstream. So that's the way this mRNA vaccine works. But this is not the real vaccine, we have to understand. This is the gene therapy which is converted to the vaccine, because we are injecting here the gene, that is mRNA. In the case of mRNA vaccine, that is from Pfizer or Moderna. And if you see the AstraZeneca, that is cDNA, so this DNA is going here, and this particular DNA is going inside the nucleus, and from here it is the mRNA is coming, and that is translating this protein in the same way. It is going and in the plasma cells and making the S protein antibody, and if virus is coming, it can attack the virus and wash away. So important difference between AstraZeneca and Pfizer vaccine is that Pfizer vaccine is not going inside the nucleus, it is just going in the cytoplasm and directly translating the S protein. Whereas in AstraZeneca, it is going in this vaccine or this DNA is going in the nucleus, and from nucleus, it is coming to cytoplasm as mRNA, and this mRNA is translating a protein. So important, we have to understand and there are a lot of debate going on side effect of all these things. So we have to understand, once something is going in the nucleus, it may integrate inside the human genome, and we don't know what can happen after several years or something. So yes, data are there that it is not harmful right now, but it may integrate and inside the DNA or the genome of the human. And once it integrates, as I told, then we don't know what's going to happen. So we have to really be a little careful, but we cannot do anything right now, because that is the only way to manage these things. So I personally think that mRNA vaccine is much better than DNA vaccine, because it is not, mRNA vaccine is not going inside the nucleus. So, India made a vaccine, very good vaccine basically, and that is the real classical vaccine, and that is killing the virus and then take the viral protein and then make the vaccine. So that is the proper vaccine. So if we talk about real classical vaccine, the India has that vaccine. I think it is vaccine or something. But all other vaccine which is available at this time point in the world is not the real vaccine. It is a kind of gene therapy, which is converted into the vaccine. So that is the vaccine, part of the facing the challenge of COVID-19. So the important is, we know why, we have to understand why the very young people are not getting affected with this COVID-19. And if they are affected and getting affected, not a lot of people are getting affected, young people. Why? Because, young people has a lot of stem cell in their body. So if the COVID-19 is going inside the body, these stem cells, which is already available in the body, is going to counter the COVID-19, and that's what young people are not having a lot of infection because of the COVID-19, but old people have more problem with the COVID-19. And there is a long COVID-19 problem, means even the people who are getting recovered from the COVID-19, after that they have several problems or several damaged organs, like starting from brain, heart, kidney, liver, lung, and those damage cannot be repaired using any kind of medicine. So how to manage that? The long COVID problem. The long COVID problem can be managed only by using this particular stem cell, because this particular stem cell has the ability to regenerate the damaged organ also. So even post-COVID related death may be easily managed by using this mesenchymal stem cell. So I'm going to share you very wonderful data which we saved a patient who was under the coma for 60 days. And so I was all over the world and news about that. So is your audio system is working if I on audio here? So this is the news.
Believes its discovery may have saved the life of a COVID patient. Our ABC attendance reporter John
So
Horton
this came on the ABC News in US.
the way to vaccine.
He was having some cysts.
Nursing hospital. That's 60 days. San Diego Srivastava and his team at GeoStar sprung into action. GeoStar is an international stem cell research firm based in the Golden Triangle. It's from cells. Michael Cord.
Slowly,
Srivastava says it took about 3 weeks for the man to start interviewing. Spent his confidence and the sea loss. Basically,
I feel so happy.
Srivastava says this kind of treatment could survive. Vaccine arrives to protect. Jeff planning to conduct a double-blind study for the treatment of it, that its conclusions are correct. That study is expected in about 3 months.
Okay,
Until
so
research issues.
thank you very much. I think I'm running out of. I'm taking more extra time to it. And if any question, you may write me directly, and I can reply for that. Thank you very much.